everyone, and welcome back to the series 5 in 5. This is the series where I provide you with 5 key clinical tips in 5 minutes or thereabouts. If you're new, then a massive welcome to you. My name is Dr. Baptiste, and if you haven't subscribed, then why not consider subscribing, because I have loads of useful content to support you on your medical career journey. As always, if you enjoyed the video, then make sure you give it a thumbs up. So in today's video, I'll be sharing with you some key tips on how you can make the most of a 10-minute consultation, any consultation really. So I thought it'd be really useful to share with you some of the things that help me in consulting in a very short space of time. The first one is the golden minute. You may have heard of that term. This is where you start with an open question like, how can I help you, or what has brought you here today? And the patient basically opens up and tells you their story. You can get a lot of valuable information from just letting the patient talk. This helps you build a rapport, helps you build a trust with your patient as well. And it may save you time later on in the consultation because you would have gained a lot of information earlier on. So before you plow in with closed questions, ask an open question and allow the patient to give you and tell you their story. Active listening really helps, and again it helps you build that rapport, which is so important with building that trust and building that relationship, that professional relationship with your patient. Here's a few ways you can demonstrate your listening actively. 1, give the patient your full attention. Show them that you're focused on them and what they're saying to you. This may include not writing or typing. Do not interrupt the patient, because this clearly shows you're not listening to them, or that you don't even care what they have to say because you keep stopping them. And even if you do care what they have to say, and it's probably a terrible habit that you may have, try and work on that habit, because interrupting people constantly doesn't go down very well. Looking for cues is important. A patient may say something to you and then stop, and then you have to basically open that statement up a little bit more. They could say something about work, and then you could say, well, what do you mean by that? Or could you tell me a little bit more about that? And that is essentially a cue. A cue could also be if the patient is fidgeting or they're not giving you eye contact. Could something else be going on there? And you can ask the patient, you seem a bit unsettled to me. Would you be able to tell me, is there anything upsetting you? Well, there are ways to open up these cues, but of course it just depends on how you do it, and just try and be sensitive if you do feel something is wrong. Paralanguage like, oh right, I see, go on. These are all really useful things to do to encourage the patient to tell their story and to open up to you and speak to you. Body language, like of course eye contact, mirroring the patient's body language, and nodding. Using words or terms that they have said, or echoing the patient. Summarizing back to them. For instance, if you've allowed them to tell you a bit more about the history of presenting complaint, you might want to summarize just then to just make sure that you've not missed anything and that you understand exactly what they've said. So summarizing works really well. Again, it emphasizes that you've been listening to the patient and that you're interested, but don't summarize too often. If I do summarize, I summarize maybe once or twice throughout the consultation, again just to clarify that we're on the same page and that I've understood exactly what they've said, but I don't summarize multiple times, and I would not encourage you to keep on summarizing. There is no benefit to that. And of course, demonstrating empathy and sympathy. Try to put yourself in the patient's shoes, try to understand what it is that they're going through. Finally, make sure you take a focused history and examination. This not only helps with consultations or short consultations in general practice, but it also helps in the hospital. For instance, if you're on call in A&E, you can't ask about every single thing. If you're on a medical take, so if you're part of the medical team or even the surgical team, you're going to ask focused questions and do a focused examination. So you might pick 1 or 2 systems to examine. Often many examinations can be kind of amalgamated, and you can do multiple examinations together, like a cardio and respiratory examination. So there are ways that you can achieve quite a lot in a short space of time, but of course, like I said, make sure that your questions are focused and that your examinations or examination is a focused and a specific one to their presenting complaint or what they've come in with. So those are a few tips to help you maximize time with your patients, and in particular very short times that you may have with your patients. Let me know in the comment section below if there's anything that you struggle with, or tell me what you're good at and what you're proud of. So that was all. As always, make sure you give the video a thumbs up if you enjoyed it, subscribe if you haven't already. I will see you in my next video.